Hello, everyone. I want to introduce Beatrice Tan. Beatrice Tan, she and I have worked in the past, and I would like to bring her wealth of knowledge. So, Beatrice, let's introduce yourself.
Thank you, Shannon. I have 30 years of experience working with the healthcare industry. Also, I have experience working with a hospice, home health, skilled nursing facility. The reason why I started working in this industry is because I myself was homeless. I left in a track and tried to find ways how I can make myself better. Not even speaking the language. I learned to speak English here. So I just want to say that they have hope. For brokenness, they have hope.
So, as a case manager, I want to ask you a few questions.
Sure.
As a case manager, what are some of the most common misconceptions you encounter about homelessness?
Well, I think they have a lot of misconception. I think they have a lot of implicit bias. Subconsciously, when you walk on the street and you see someone in a tent, someone that don't walk without a clothes, I think someone that have this jerk movement, already you say, you know what I mean, something is wrong with them. A lot of people also say that client, sorry, I'm sorry.
Yeah.
Sorry.
No, because they're your clients.
Yeah.
They are. You serve them and you help them. And
No. I think the thing is, we think they are lazy, right? They feel that they have nothing to bring to society anymore. And I think homelessness is a disease. Sometimes I feel that people think that homeless is, it's a condition, is due to environment, it's where they grow up. It's also, they grow up in a foster care home. When they reach 18, they have to be out of the system.
You transition out.
I encounter a lot of people on the street who were coming from the foster home. Another thing I'm seeing is kids with disability. More and more kids on the spectrum are becoming homeless and get influenced by,
The homeless, from my experience, I've noticed is that a lot of it stems from childhood trauma and them not being treated at that moment. And their experiences that they have had haven't been treated. They haven't had the proper, I would say maybe the therapy sessions, and it was kind of glossed over. Either they were shuffled through the system and it was never addressed.
Correct.
And then now when we get the client, they're over 18 years old, and then now they have a substance use diagnosis along with maybe a mental health diagnosis that impact them from their childhood trauma, and it never was addressed.
Correct.
So now we're just kind of not addressing that issue and giving them medication and then trying to find them housing, but they have other things that they need to work on. And I feel that at sometimes those are not being addressed. Do you agree with that?
Oh, yeah, totally. I agree. I think it starts in the home. I feel that we need to learn how to prevent and develop a proactive approach. And I just think that as parents, I think, and all of us, we do have a responsibility to be aware of what's happening with our kids.
Correct.
Sometimes, they show sign that we ignore.
Correct.
And we put them in front of a video game or, a quick fix.
Correct.
However, it can go to a point that they will end up maybe going with the wrong people. They will also start maybe, they can start drugs. So I feel it's really, everything for me start at home. I think the prevention start there. And I think that's what I feel that which makes sense to me. Yeah,
starting at home, because from my experience, what I've noticed is when I've worked in the past or I've interned at a drug treatment center, a lot of the women there were impacted as a child, and they were introduced to I think we throw the word around trauma, but some people have really endured traumatic things that have happened to them that maybe they don't even have the tools on how to cope with those skills or finding coping skills in order to be able to function in life. And from a case manager standpoint, we get the clients, they have transition, they maybe overlaps, and they go into the hospital setting. And then now we're here and we have to discuss with them options on how to now find housing. So when we have those type of clients, what do you think are the tools to help? Because we do have the resources to help them, but what are the tools to make them more functionable in life? Because the overall goal is to make them productive and to help, especially the ones that can work. So what do you think are the tools that needed to kind of help them to navigate through life and make them a little bit more independent and not really rely on other people?
Right. Okay. So I think they have housing first approach. That's affordable housing.
Right,
That's
right.
number one. They have treatment also that will help them. It's like to help them with their condition, right? But I think personally working with this population right now, right? I think it's really to meet them where they are. It's that when you go on the street, and I do that every day.
Right. I know. You work right on Skid Row.
I went on Skid Row,
Right.
Even the jails.
Right.
Yeah. But I think sometimes we feel that we are there to save them. And we are them, okay, we want you to be house. But sometimes you have to meet them where they are.
You do.
They do have a
sinners.
past.
Yeah, right.
Like you mentioned, right? They have trauma.
Correct.
They may be abuse, right? So I think is to meet them where they are and then start to work with them. Like, don't expect them to know already. And the way I say it, I always, when I meet someone, how can I help you? What can I do for you? Right? And find ways, like through the nonverbal, the way they show themselves, like,
The nonverbal cues.
yeah,
Yes.
I think nonverbal cue, I think you're right. That's a big thing. But then really know what they understand, number one, right? And then where can you bring them from that to move them into maybe housing? And from housing can be, hey, you want to go back to school, right? You want to have an education. And then, oh yeah, I want to, they will say yes. Or they will say, no, I want to work. Or they like a pet. So they have different things that will help them. But I think the first approach is to build a trust, is not looking at them, hey, you are homeless. Like I say in the beginning, right? It's not a disease. And by the way, anybody can become homeless.
It's very quickly.
No, we
Right,
are one
right.
paycheck away.
Right. No, seriously.
That is serious.
And I think when you work in the industry, you realize how quickly your life could change. We have experiences helping people that had careers, and then life tragedy happens.
Oh, yeah.
And then you're now homeless, and now you're facing the same issues that you thought that you were above. So I think working in the industry, we have a level of humility because we understand that life can change. You could get sick. So many things could happen to you where it can impact your financial life.
But I have a story. I have this gentleman. He had an eviction. The sheriff came to call his thing. I met him in a motel, and that was very touching because he was a professional drummer, and he was also he was not an actor, but he was with the skill, the motion picture.
Right.
And when he was sharing his story, I'm like, wow. See, I feel that people who are homeless, they are people. And they have a story. And they have a life. Right? So anybody can be in that situation.
Right.
Look what happened with the fire. You know what I mean? Yeah, in 2 days, people lost their home.
Everything.
Everything.
Right.
Right? And what they do, they are couch to couch, R&B.
Right.
They go to motel. They don't have stability.
Correct.
So sometimes I think we need to take away the homeless. I think we are technically all of us can become homeless,
We saw that during the fires. You're absolutely right.
right?
So with those type of situations, I think that so case management is very important because they need the tools to
Right.
help them navigate. Because a lot of the times when we see homeless, the ones that how we depict what homelessness is, I feel that they have not had the opportunity of someone pouring in them in. When we would work with them, I was always say, like, how does it feel if you had no one ever loved you? So if you had somebody that never cared if you ate, if you went to school, or even followed up on your life, and now that you're getting that as an adult, it's hard to trust, like you said, to build that rapport and that relationship with them.
I think they have a time. I think the most important thing is to build a trust. If you don't have a trust, it's going to be very hard for them to even follow you. And case manager, I think it's an amazing work. I work with so many of them, and they dedicate their life. They go on the street. They hug them. They buy clothes for them. They buy shoes. They care. But again, to figure it out a way for them to get out of homelessness, we have to have an approach that is not judgmental. That is not I know better than you.
Right.
Right? Meet them where they are. If they are on the street, I go and I do assessment. I like to see eyes to eyes. I want to know.
So I also, when you're saying that, to cut you off, I think about how it was publicized and they made it seem like it was horrible when they did harm reduction. And people are not educated about harm reduction, especially for those that are substance users. Like, they're handing out needles, they're handing out drugs to people. So I think people are not educated on the different strategies that we use to help people to meet them where they're at. So have you had any experience with harm reduction?
Oh, sure. Yeah. So we do have clients who are using, and it's very hard for somebody to stop.
Right.
Oh, we want you to be clean, right?
Correct.
Oh, we're going to find a place for you, but you have to be clean.
Correct. And then now they're like, I
right?
guess I'm comfortable
but they
where
are
I'm
not
at.
there yet. Again,
Right.
you have to meet them where they are.
Right.
I think having a safe place for them to do their drug, I think it's not safe to be really on the street and for them to be abused, assault,
Right.
being like, they, with a drug dealer, they are prey to drug dealer.
Correct.
Right. So I think, harm reduction is a great approach, but you still have to be in a special place for them to do their drug, to have clean needles, to be safe. It's a safe space.
Right.
Right. We work a lot with facility, and we are educating our facility right now to develop a safe space. Because before they had this one, the elderly client, they don't deal with drugs.
Right.
Not too much mental health, right?
Correct.
But our population right now that we place into facilities and home, they are not like they were. So we need to develop this safe place. And I think harm reduction approach is very important.
It is very
Educate
important.
us how to, even Naxalon, to be trained how to do Naxalon. Naxalon is like, Narcan.
Right.
But to be able to, if somebody overdose, you're able to help that person. And also methadone, that's another one that, they have treatment for that. But again,
we have a lot of experience when we help help people find housing, and they have a history of substance use. Then they get kicked out of their housing due to that. But it's on their medical record. You understand? But it's not something, like you said, once you get discharged, they go through detox. They don't have the support in the community to connect them to stay sober.
yeah, well, we do have a lot of even in-house. We do have agency who go there. They do an assessment and evaluation.
Okay.
And then they do treatment in the boarding care, in the facility.
I think a lot of that needs to be more promoted.
Yes.
Because a lot of people don't even understand, when I say people in the industry, they don't understand the resources there is to help and connect a lot of the members we serve.
I think education is number one, knowledge. I think I think they have a lot of stigma when it comes to homelessness.
Correct.
I just feel that they label them, right? And then when they look at all the paperwork, and say, oh, this patient,
It's going to be problematic.
right?
Right.
He has a list of drugs, a list of medication, right? But again, I think we need to take that away. Again, this is a person, right? And I have a place where they can go. What resources can I bring, right, to help this client?
And
So, yeah.
and it's almost like contradicting because the person also has to want to participate as well. So if they're not willing to participate, I think in our industry, people feel that we could force them, but they have to be a willing participant. We cannot, if they don't want the treatment, we can't force the treatment on them as well.
No, you cannot force. It's all voluntary.
Correct.
However, I always have a thought in my mind. I think they have a percentage of people who are homeless, who are drug addict, but also who has lack of capacity. And I feel that sometimes we should have a treatment first approach
Correct.
before even we house them.
Correct.
But this is a very small population, a small percentage of homeless. And I think having more money, more facility, right, that can address that. Because sometimes they don't want treatment because they don't understand. They feel that, it's just, it's okay if I'm taking my drugs, blah, blah, and I'm going to do whatever I want to do. And I'm working with a case right now. This gentleman is 27 years old. And he's also possible on the spectrum. He's been placed to facility, to boarding care. They tried to do some rehabilitation, mental health. He refused everything.
Right.
He doesn't want anything. But I'm working very closely with him and try to help him. But I think this is a very good example that we should advocate for treatment first for him. Because I don't think so he have fully the capacity to make that decision and say, hey, I want to do something with my life, right?
So how do we...
They need that push, They need like that something.
So when you say they don't have capacity, to me, when people think of that, it means that you still have your decision-making skills. So he knows right from wrong. But you're saying based off of his diagnosis of being on the spectrum.
Yeah, I don't think so he know right from wrong. He has a friend. I think he has 37 phones already that he lost or he sell them. I don't know what he's doing. Every time he go and visit him, he's on the street, no shoes. He has some wound on his neck, right? That every time he go to the hospital, he has fear of the hospitals. So this is what I say, like a capacity. He cannot like make really decision for himself. And this is a case that he may end up, something may happen to him.
And it's, I feel now we're placing more younger people, the ages between 21 to about late 40s, that do not have the capacity to live independently.
Yeah.
And as we were talking about long-term care, people feel that long-term care is just for seniors. But we handle more people with mental illness and substance use than we do versus the senior with dementia. I've come across placing more clients that are early 40s versus someone 80. It's very, now it's kind of the trajectory is changing, that the long-term care industry is more focused on this level of crisis, I feel.
Yeah, I think the population changed, that's for sure. But again, is the boarding care industry, and you know very well
Correct.
how boarding care work. I think it's to really develop program within the boarding care.
For adult residential.
Yes. Adult residential, but also like residential care facility, right? They have a lot of younger people who do have substance use, mental health, but also physical needs. I had a client who had stroke. They were, 28 years old. Stroke with addiction, mental health. So they need help with activity of daily living, right? Like bathing, dressing.
Correct.
Right? The population is getting younger, but I feel that is the treatment, the housing need to be more equipped.
For younger addition,
yes.
Younger population.
Right. And also be equipped with addiction treatment, how to address, how to de-escalate situation, right? And not be reactive. When somebody show a behavior or, throw something, right away they call 911, right? But no, how do you de-escalate the situation, right? How do you observe and look at the at your client and say, okay, this is how, I'm going to calm him down.
But I think when they removed a lot of the mental health facilities, they're not equipped for this level of population that is currently needing housing. So I don't, there's more training that needs to be involved
Right.
regarding mental health versus, because it's not the same seniors. When we think of ADLs, we think of, okay, let me help you, encourage you to bathe, groom, dress, to change your Depends, your insulin.
Right.
This is a whole different level of population that requires a certain level of care.
Right. No, I think you are right. But I feel that, and I think this is what the missing link is.
Correct.
And this is just my thought, okay? I think we need treatment first approach. Treatment. We need to have facility that, need to be, I'm not saying lock, but maybe semi-lock, and really work with them.
Because there's
No.
there's none.
No.
So if you're 27 and you need a secured facility,
Right.
you're not, there's no place to put them.
They have treatment, but it's a long process. You will have to go to the emergency. Okay, first 5150. You know what 5150
Correct, right.
So 5150, then you go on a hold, then you go to the hospital. The psychiatrist at the hospital will decide if you're really in danger to yourself and to others.
Correct.
Then they will put you, if you are in that stage, right, LPS conservatorship. That's where you go to the IMD, and that is a locked facility. But that's the only thing they have.
But they only have a certain amount of beds.
That's right.
So they only have like 20 beds for the entire state of California.
Yeah.
So when that's full, you can't live in
Right.
you cannot live in the hospital. So where do you go?
That's the correct.
Because I mean, it's a very small bed. I mean, there's like, you're lucky to even get a bed.
Correct. But that's a systematic issue.
Correct.
Our system has a problem.
Right. It is true.
Okay. It's I feel that we need to advocate. Okay. We need to advocate for secure facility. Why? Because they have a percentage population who are homeless, who do need that services.
They do, but we need to advocate.
But that's why we need to advocate.
And
I
let
think
them
we
know.
need to go to our legal representative. I think we need to start to let them know the issue. We work in this. I work in this. I've been
Right.
on Skid Row for 10 years.
Right.
I also did assessment in the jail, from Twin Tower to Women's Tower to the
Right.
plastic jails, and I see the brokenness. I see these people want help. They just don't know how. And sometimes the way we want to help them is not helping them.
No, it's not.
Okay, so we give them a home and then take care of yourself. They don't even know how to turn the water. Mostly they never sleep on a bed, right? So, I had a client, he had a tent inside his own apartment.
Oh, wow.
A tent. And he will not sleep on that bed because they are not ready for this. We need to really have treatment. We need to address this. Have a right evaluation, psychiatry, psychologist, case manager, behavior therapist, adaptive skill. Because I think behavior therapist is only focusing with the regional center. It's a positive approach toward behavior, right? It's more like they replace the negative to the positive, right?
Right.
I think we need to incorporate all of this. And I think that can be a solution.
That is a solution.
But we need to put money into this. We need to have facility. We need to, make them understand that it's a need.
We have to restructure the system
Yeah.
that we currently have.
Yeah.
Maybe putting different regulations in and having staffing that the facilities were required to have these level of expertise
Right.
to help this population of people. From my experience, I understand that a lot of when we try to place them, it's really difficult, and trying to have them follow a system and saying, okay, you have to check in before you leave, and if they do anything wrong, then their housing is at risk, and behavior issues that happen there that are trying to be controlled by medication. But like we said, you're dealing with someone that's 28 years old and you're trying to have them in a shared room. It's not the best environment. And then trying to work with them during their coping skills of that. But like you said, there's not enough resources to pull this in to fix the solution.
Yeah, they don't have
Or
resources.
provide a solution.
I don't think so. Even the facility I'm talking about exists.
No, they don't. That's what I'm saying. There's nothing. It's like a wand you're trying to
No,
wave.
but I think it's good to have at least the dialogue. I think we should talk about it.
Because it's not just housing; it's a bigger issue than it's. And when we say long-term care, we're placing people that are a lot younger than 75, 70. I mean, we rarely place people that are older. I'll look at an age. The average age right now is about in their 50s.
Yeah.
And then they're not 75, 78 years old. Some people are 50 years old that had a stroke, and then now they're facing homelessness. So I think, like you said, the approach needs to change.
Yeah, I think the approach is to share. I think I like the treatment first approach. Like I say, I like also housing, because without a house, what are they they don't have an address, right? I mean, they cannot. It's hard for them to get anything, right? So a house is important, but first they need to understand, right, what we are doing with them. I feel sometimes they don't. They just think, sometimes I feel give me.
Right, that is true.
But they don't have the understanding. They don't know the value of things.
There's no goal setting.
A lot of them.
Right.
And I'm not talking about all the homeless.
Right.
I'm not talking about that. I'm talking about a group of people who cost so much to the state. And even federal, by the way, but who cost so much, because they go back in the system. They go to the emergency room and back to the hospital, and then it's just a circle of no return. I just feel that we need to address, and the way to address, we need to have treatment facilities that specialize, right, to specialize with mental health. I know they have DMH, and I know, but they are very limited too. But this facility, it should be all of us effort. We should be on a round table and put everything on the table and say, okay, this is what we need.
So what I think also happens, the one that you're saying, that constantly saying, give me, give me, give me, they have learned the system.
Yeah.
So since they learned the system, they're aware of what the resources are, and they exploit those resources. Then those people become the focal point of this is why we don't want to do this, because they're exploiting the resources, but we're not paying attention to those that really need the help.
Correct. And you know what? More and more elderly. It was a few years ago, I was really involved with the Adult Protective Services. And you can see the eviction. And really, they were elderly.
Yes.
Okay, so what happened? The sheriff, I was there, right? So I tried to calm them down, but the sheriff will be there.
Correct.
It's very emotional experience. They will put the lock. You have to be there with them.
Oh, wow.
And this is elderly. I'm talking about 60, 70, 80.
And handicapped, and they need assistance.
Right.
Right.
So it's really affecting everyone. But I think for me, the one who costs the most money are the people who are high utilizer of our system and back and forth to the hospital. And sometimes I don't think they fully understand what they want. And that's why we need to guide them. We need to help them to if you want to be housed, if you want to, what level of care you need.
And identifying that. I think that especially those that are high utilizers haven't come to the understanding that you need 24-hour care.
Some may, yeah.
Some haven't come to that realization. So then that's when we have to have those difficult conversations that you cannot keep coming to the hospital as a source of a resource to assist you with your...
Or they don't want to pay their rent.
That is true too. We've helped people.
So what happened?
They'll go to the hospital, but then they still end up getting evicted while they're at the hospital because the landlord's claims they don't know where they're at. Right. Then the eviction process happens, and then
I think we are going into a circle. Like I said, a point of no return, right? That's why I feel that we need to, when we observe that a client are dependent, right? Then when we do the assessment, we should be able to have them go maybe to a 24-hour care facility.
Correct.
Even if it's like temporary.
Correct.
But at least there they have caregiver. They will manage the medication. They can help with ADL. They will have 3 meals a day. So I feel that will be for the people who are dependent on the street. I mean, people who need that help and that support. I think that should be the approach for them to go to a licensed care facility. Now, I was mentioning a lot of them don't pay their rent.
No, they don't.
Okay, so that's becoming a problem, and I'm dealing with few of those. So we try to explain to them. We even itemize all the services.
And like how much this will really cost you, but we're subsidizing
Right.
this, and you have to pay this portion,
Right.
and you can't live anywhere for free.
Yeah. And then they go to, then I tell them, if you go to a motel, that will be the cost, but then you don't have food, but then all this is included. But again, they want that freedom. A lot of them, they have this addiction, so they go back where they can, when they can get what they need to get.
Correct.
Yeah. So
We struggle with that because what do you do to a person that doesn't want to contribute to their livelihood? So you're trying to educate them and say, listen, you're going to be homeless. And they're like, that I'm fine with that. But you're going to end up back in the hospital when you have a flare up, and we're going to go through this whole system again. So I think with that, there needs to be more advocacy regarding a conservatorship or somebody to help them pay for their money. Because if not, we're going to just keep having this, I think,
That's right.
more on-demand conservatorships to help them, because clearly you're not making the best decision.
So our role, we have so much experience.
Right. Correct.
Is to start to advocate.
Okay.
Go to our legal representative, and all of us is to go to the legal representative, right? And start to say, this is what we need. We need this. Because we are not going to face, homelessness is a crisis. And I don't think so it can stop unless we address the cause, the main issue. And the main issue, again, is they are so used of this. They are so used in the cycle of what they are doing. When I walk sometimes to go to work, they go in the garbage, but they get food, right? They have food stamp, they have water, free, they have everything they need, right?
But
or they walk without shoes.
And you could give them a pair of clean, brand new shoes, but
and they will throw it.
Right. Or sell it.
Or sell it, yeah.
Right.
Or sometimes no clothes.
Correct.
So it's becoming a natural thing for them.
It's a part of their condition.
Yes. So how do you, to be homeless is one way, right? How you make it a different way. How you go from homelessness to home.
How I would see it is like a diabetic. You know that if you eat this food, it could cause you to have a flare-up.
Correct.
But people still choose to follow the poor diet and they have a flare-up. I think it's the same diagnosis. Right. Where even though you provide them a solution, you're saying, okay, this is what you need to do. They'll still shift because it's psychologically they are sabotaging themselves. So you give them what they asked for, and it's still not going to be enough because psychologically they've had a cycle of being chaotic their whole life.
Right.
So this sense of calm doesn't give them. It's almost like a shock.
Right, because they are not ready.
Right.
See, we have to go back being ready.
Correct.
Right?
But how do you know when they're ready?
Okay, so that's why.
Because you could do all this, you can explain it, and they're like, yes, of course. And then you go through, we've done it together where you found them, helped them, you stabilize them, and they'll self-sabotage themselves. And then we're back to the situation.
I think the best thing when you do your assessment, when you meet the client first, right, try to build a little trust. That you can get in a little into what they are going through. Yeah. I think it's to build a trust, is to get as much as information as possible. Find out if we find, let's say, a boarding care, right? A place that at least they will be happy. Let's say they like a pet, right? They want their dog.
That is true.
Or their cat, or their bird, right? Sometimes they even have snake, but yeah, we don't.
But who's going to pay for this animal? No. I have that come across that too when they want animals, but who's going to care for
we advocate.
You advocate?
Yes.
Okay.
So I tell them this is a pet that is going to help. And I think you need to accommodate. Now, what we do, I know sometimes we want to make sure they are able to walk the dog, right?
Okay.
Otherwise, it will cost a little more money if the caregiver has to walk the dog, right? But the dog is a therapy. It really helped them. I have a lot of clients that we place. And yeah, we did advocate for the boarding care. We say,
So who's going to feed the dog? Who's responsible for that?
The caregiver can be responsible. Sometimes the client can be responsible. It depends, right? But I'm not saying everybody need to have a dog. I'm just saying, no, I'm just saying they have something
To look forward
to
to.
look for them that will motivate them. I think I like that word, motivate,
Okay.
right?
Right.
For them to go with the process,
Understood.
right? And you mentioned people who don't, they don't understand. And yeah, that's why we develop care plan.
Okay.
We develop, a plan because each one need a plan. If you have a problem, you develop a plan, a step-by-step, short-term goal, long-term goal, right? To achieve what you want to achieve. Because again, they are not in their right, some are not in their right mind. And you mentioned conservatorship. I love that idea because conservatorship, the problem is so limited, right? So again, we need to advocate
They need
to
someone to help.
expand
Right.
this, right? And also the 5150, right? It's not only people who are in danger to themselves and to others, but people who cannot feed themselves, people who cannot take a shower and are on the street. I think it should be a 5150, right? So I think we have to redesign some of these things that's happening right now, and I don't think it's there. But again, I'm here. I want to advocate. I am, again, that's my passion. I love what I do.
Right.
And I was sharing with somebody, I know a lot of things about federal cutting, and we don't know what will happen with our state.
Correct.
But it's my passion. I will still do what I do.
We still will have to do what we do
Because
and take
we care.
And we want to see them succeed.
Right.
So
Yes.
I think it is important and a lot of advocacy and restructuring because the population has shifted so drastically
Yeah.
that we're serving now.
Right.
And there's a lot of more therapy and psychosocial that needs to be addressed before we just throw money at housing.
Correct. I think throwing money at housing is just throwing money at housing.
It's just housing a problem.
No, exactly.
Right.
Yeah, because I don't think so. We fix again. They are within. They are in the system, and like from foster care, baby who are born addicted because of the parent.
Correct.
Jail, father who are in jail, mother has to take care of their own children. It's a system that we need to break. Sometimes I just feel this is a system we need to break.
And the mental health aspect, I think, sometimes is not treated, like
No.
we keep saying. So then that's the reason why we're back again and again in the
Right.
same cycle. And if you actually sat down and spoke with a person that's experiencing these issues or concerns, you hear about their stories and what they went through. And we tried, and they talk it through. When I worked at the treatment center, they were saying that, I would take the drugs to suppress my thoughts. So you're taking the drugs to suppress my thoughts, and you're like, well, how is this person only 22 with schizoaffective disorder? And then she tells you her stories. So then it's like, then the treatment centers are not there to treat the mental health. They're there to help you with the drugs. But her concern is, okay, so once I stop the drugs, I got to deal with these thoughts and what I've went through. So how do I treat that? So what do I do with these thoughts that I've had since I was 5 years old? And now she's sober, and now she's dealing with these, and now she has to deal with that trauma. So it's like almost like you need both in order to make the person
Right.
whole.
It's a holistic approach. It's
Correct.
holistic, right? So it's, like circle of care, right?
Correct.
It's a nonprofit that is very dear to my heart. 2001. But the reason why the circle of care is because the client is in the middle.
Correct.
You develop a support system. The support system is also family. It's also church. It's also, your neighbor. It's also the grocery store.
Right.
Sometimes we forget this, right? And I think we need to create this support. And again, like I say in the beginning, right? It really starts at home. See, if you have a child that already shows some sign, right? Just address it. Let's develop a preventive approach instead of a reactive approach. I think that's something very good. And I think we also need to involve our faith community. We need for the churches to start to get involved. Develop maybe a substance use program. Understand the congregation and educate yourself. Learn how to navigate the system, right?
But I think there's so much of stigma around substance use where people feel that it's a certain population that only has substance use because it's hidden. So if you're going to in certain communities, they're not going to divulge that their son is on drugs. They don't want to necessarily say that. So it's kind of hidden, and they try to do other things so then that their neighbors don't know because they don't want to have that stigma.
Yeah, and you're right, they have a lot of stigma. But I think we have to, if we want to take care of something, right, I think we have to remove this. This is not a problem just one group of people have to deal with. It's our problem. It's us. Together, we need to work on it. Yeah. You're right. If a child takes drugs, the parent wants to isolate. Like a child who has autism, what do? They keep him home.
Correct.
All right? But what is the best approach? Keeping home?
Right.
Or
no, socializing the person.
There we go, right? So I think it's not really the person who's taking drug or the person who has mental problem or the person who's autistic, right, who's on autism. I think it's us, the way we respond to them, the way we see them. That's why when we meet them on the street, in the jail, wherever, right, meet them where they are, not judge them.
See them as a person.
See them as a person.
Yes.
But we need to educate our society, our community, right, to look at the same way. We need for them to understand that it's not a disease. Even homelessness is not a disease. Addiction, it's unfortunately it can happen when they were young. I have my daughter has a friend. They were both in college, and they drink, they take drugs, right? But unfortunately, he had one drink because he was predisposed to be alcoholic.
Okay,
he became alcoholic, and so they have a lot of situation that
could spiral out of control. A situation
right,
like
but
that.
They don't have So people are predisposed to things too, right?
Correct.
Yeah, but I think we as a society we need to stop to look at people differently. I think we need to break that wall of judging people. I feel sometimes,
Well, we think it can't happen to us.
It can happen.
So the problem is like the homelessness, like you said, the fire. So you don't think that you cannot be homeless, or like my child would never do drugs, or you don't think it could happen to you. And then when it happens to you, then you're more sympathetic to that person, and you see the human in them because now your loved one's going through that. So that's why I think it's very important in our industry. The people that are more successful or that able to resonate with different communities is because of life experiences. And I think when you lack life experiences and you just try to get into an industry without having those experiences, you don't see the human in the person. It's just a job.
Right. And that's why not everybody can do this job.
No, they can't, and they shouldn't.
No. But unfortunately, a lot of them,
a lot of them do, and you're like, well, I don't know why you're here. Right.
No, but not everybody.
Okay.
Yeah, I think it's you have to have a calling.
Correct.
Right? Because again, you want to make a change. Right? And the reason why I say faith-based is because I believe that they have a message to tell. And it's about love.
It is.
It's unconditional love. Right? It's a love that the reason why they go to that faith-based or that church is because they understand that love. So it's for them to walk into that love.
Understood. Okay. Well, it's clear that homelessness is multifaceted, an issue that requires our attention and action. So if someone is in need of help and they need to reach out to local organizations, which ones do you suggest that we could basically, what resources do you feel that a person could reach out to? 211, what do you think they should contact?
Okay, 211 is one. I mean, when you call it it's like forever, right?
Right.
I think if you have an emergency, you can go to the hospital.
Okay.
Hospital have a system, like if you need, they can help you find a shelter. They have also Recoup Care. Recoup Care is it's a non-licensed facility, but they have nurses. So let's say if they have a wound, they are able to take care of them. And then also they help them find housing.
A lot of case management. So your local hospitals will help you
Yeah,
navigate and reach out to different
Right.
organizations that could connect you to more of these resources.
Right.
Well, Beatrice, thank you. Thank you for spending time with us
No,
and
thank you.
discussing something that's so passionate to you. It is clear that homelessness is a multifaceted issue that requires our attention and action. Remember, understanding the roots of homelessness is the first step in breaking the cycle. Join us next time as we continue to explore solutions and share insights from our professionals in the field.